Oh, okay, let's go.
So good afternoon.
Let's start.
Good afternoon, all of you, and welcome to this important meeting that we are having today in the presence of our Honorable MEC for Health Northwest Province, Madoda Sambatha, the health officials from the hosting district, Dr. Kenneth Kaunda, health officials from the 3 other districts of Northwest Province, our esteemed healthcare workers that have come from Cuba to assist us in the fight against the COVID-19 program, Sanko, labor, and media, and everyone else present here for this particular function. The idea of this function is to welcome the 13 healthcare professionals that have arrived from Cuba and to deploy them into the various parts of our province in our fight against COVID-19. And at this stage, I would like to request Ms. Nella Mojanaha, the District Director, Chief Director, to come and welcome this gathering.
Good morning, ladies and gentlemen. Saluda. I have to put in the mask. Saluda, ¿cómo está? Saluda, ¿cómo están? MEC, the different labor organizations, Sanko, media, health professionals, and most important of all, the Cuban doctors. I'd like to start this welcome with a quote from Stephen Covey. He says that work is the tax we pay for living on earth. And we all know that Cuba has got a history of coming to the rescue of its fellow men. And this is done without preconditions or structural adjustments. The greatest legacy that Cuba has given to us is their contribution to healthcare. We have several, partnerships with them, the most important one being the training of doctors. And Cuban doctors have also assisted us in this country to establish regional and tertiary services. We welcome you to the province of humble and a very warm people. Bienvenido, amigo, amigui. Thank you.
I want to give you a bit of a brief about this delegation that have arrived to serve this province. As you are aware, the close to 200 healthcare professionals from Cuba arrived in South Africa on the 27th of April, and they had to go through a period of quarantine for 14 days, and they were then ready to be deployed into the various provinces from the 15th of May. So the delegation that was allocated to Northwest Province is a number of 13, and they arrived in Northwest Province in Klerksdorp yesterday evening. So today we are welcoming them. The 13 includes 8 family physicians, a biostatistician, an epidemiologist, and 3 healthcare technologists. These professionals will be distributed across the 4 districts for the various purposes they are allocated for. Our family physicians, 8 of them, will be allocated to the 4 districts to be on the front line in COVID care, whether at primary health care or in the treatment of COVID patients. Our biostatistician and epidemiologist will be involved in that function of analyzing and assisting us with the data management of COVID management in the province. Obviously, the care of the patients involve use of multiple equipments, including ICU equipment. So we believe that the healthcare technologies will also be very useful for us in maintaining our equipment. So the next thing is to officially introduce the 13 healthcare professionals from Cuba. It will be done by Dr. Ricardo Gonzalez. Dr. Gonzalez has been one of the most longest serving Cuban doctors in this country. He arrived in 1996 and he spent most of his time in Eastern Cape in Port Elizabeth as a pediatric surgeon. And subsequent to that, he came to Clarkstorp, he and his family, his wife and his daughter. His wife is a psychiatrist and the daughter is a pediatric psychiatrist who are working in this Kenneth County district. He is also the coordinator of the Cuban program in the province. I would want to invite Dr. Gonzalez to come forward so that he can introduce his comrades and colleagues and compatriots who are here to serve us in fighting this epidemic. Dr. Gonzalez.
Okay. Good afternoon, everyone. The Minister of MEC of the province, dear colleagues and officials of the health service in the province, dear Cuban doctors. First of all, I want to say some words that say, Professor Luke, I've been a witness of this Cuban-South Africa collaboration practically from the very beginning. We have to mention here that this is as a result of solidarity and friendship, mainly between our great Nelson Mandela and Fidel Castro. We are the son of this collaboration, and this is the last chapter, not the last chapter, the last chapter at the moment, the visit of the deployment of the Cuban doctors to help with this pandemic, as our tradition that the Cuban doctors are spread around the world, helping who need it for our sake of collaboration and health for all. Okay, I want to introduce the doctors who are coming. As Prof. Luke says, 8 doctors. I will mention them. Please to stand when I mention them. The first doctor is Anabelkis Valdez Caturia. She's a family physician. Is deployed to roster. Should I say where they go? No. Okay. Okay. Then Orlando Horacio Telles Almiral, family physician. Ramon Pupo Perez, all family physicians, all of them. Reinaldo González Montero. Juan Antonio Muñiz
and
Casanova.
Those that are announced, come on the front, this side.
Okay, all I mentioned,
when they
please.
call your name, come in front. Thank you.
All I mentioned already. Juan Antonio Muñiz Casanova. Odanes Marrero Linares. Randy Barrera Corrales. Barrera. Mayelín Mencho Curvelo. René Cuevas Pichardo. Alexis Álvarez Águila. Then Richel Martínez Rodríguez, who is biostatistics. Yulersi Reinaldo Mejías, epidemiologist. Rafael Fonseca Valdez, also health technology. I mentioned everybody? Okay, we hope the best for them. I'm sure they will be ready to work as soon as possible, get deployed, and in a few weeks or a month, they will be one of the South African doctors. Okay, hope the best for them, and
yeah, let us give them a round of applause.
Thank you very much. Thank you very much. Thank you. They can take seats. Thank you.
Our MEC for Health has been in the forefront of fighting this disease right from the day we started this program, and he has been all around trying to lead us and guide us. Now I give the opportunity to the Honorable MEC Madoda Sambatha to address us and formally welcome the Cuban collaboration, or we call them the Cuban, they call them the Cuban brigade, into our province. MEC.
Thank you. Can shift. Thank you very much. Let me first acknowledge the management of the Department of Health, all levels and all districts here, and acknowledge the Alliance Secretariat, both province and region, acknowledge the health unions that are here, but also acknowledge the fact that when we are welcoming 13 members of the Cuban brigade that is coming from the deployment nationally of Cuban professionals who are deployed to help South Africa strengthen the response on COVID-19. This is, I must still reiterate, it has nothing to do about taking employment of South African health professionals. It has all to do with the strategy to mobilize resources, both financially, PPE, and in human capital, any available resources in the world that could be used as the basis to respond in the challenge the country is facing on COVID-19, but also in the challenge the world is facing, because we're not alone facing COVID-19. The world has the same challenge altogether. If we would have to deal with Cuban professionals in our province, the reality is that the first contribution that Cuba did was the contribution during the liberation struggle, when political parties at a particular time were banned and our revolution was persecuted under the notion of political parties being banned, and Cuba contributed in our revolutionary battle. First, when we were banned, and secondly, our relationship with Cuba then became formal post-1994 in terms of a bilateral government relationship, government to government, the government of South Africa then after 1994 with its first black president elected democratically, being President Mandela, and then the relationship strengthened under the leadership of Comandante Fidel Castro in Cuba as a Cuban president at the time. From that process, we then had benefits of getting Cuban medical scholarship exchange, which exchange we still are strengthening even this time. If you would ask, we have more Cuban-trained doctors in our province. And in actual fact, even in this room, some of them are from Cuba, trained, qualified as doctors. In the process, Commandant Fidel explains this thing very clearly, as if he was once envisaging of this situation that the world would be faced with, that Cuba does not move around and bomb countries, and Cuba does not send missiles to any country. Then he concludes and he says, all what they do, they develop health professionals, which health professionals, they are not developing only for Cuba. They develop them to deploy them in any nation that would have a need of an intervention that needs medical practitioners. Here you are today. 13 of you are deployed in the Northwest Province. Exactly what the commandant said, that they are developing health professionals to deploy to nations for assistance. And this assistance is appreciated and welcomed in our province. That's why we are here today. In actual fact, one of the realities why we are here is the fact that capitalism has once again showed the world and humanity that it has no capacity to resolve human challenges. Capitalism has once again showed the world and the globe that through its own processes, humanity is under challenge. One practical example is that at the eve of the outbreak of COVID-19 in the world, what capitalism does? The prices of anything that has to do with protection against COVID-19 goes up. All it does is to exploit profit, even under circumstances where we would expect that profit maximization must never be the main theory of the game at the time. What happens? PPE prices go up. What happens? Everything that has to do with the fight against COVID-19's price goes up. It's a capitalist system that tells us that it has no human value. It's a capitalist system that tells us it is also not capable of even helping society and the world resolve and confront and win against COVID-19. It is a situation where nations needed to work very close to each other, because COVID-19, as its outbreak, has no national boundary. It has no race boundary. It has no political ideology. It deals with capitalist mentality equally as it would deal with socialist believers. In this instance, your arriving in the country and finally deployment in the province is welcomed by us. In actual fact, you are going to be deployed for the response, but wherever you are, you will be working hand in hand with the current provincial response staff. You will not be alone where you will be deployed. You will be with our staff in the province. This is Northwest Province. This is the province where we are at 63 in terms of the numbers of positive cases. This 63 has 28 of recoveries. We keep on saying we don't have to say too much about the number and don't say too much about recoveries. The reason South Africans must never fool themselves, even in the province, that the number is low, therefore risk is low. South Africans must never fool themselves in the province that there's a higher number of recoveries, therefore death rate is low. It should never come to that element. All of us must take the response and the response strategy at the highest possible rate on the basis that the interest of government, especially a most caring government and a democratic government, will never be on the basis of accepting either exposure of health personnel or death rate of those that would be declared positive. Ours is to ensure that the fight has to actually be won on the basis that South Africa must finally be clean and be free of the virus. As you have come, you are joining us and everybody in the country on the fight, and the fight has to be strengthened. It is not about the numbers a province has. It's about the exposure the country has. Even in the numbers, we may not have to celebrate or be shocked by 13,000. If the exposure rate is more than 13,000, we want to know as a caring government as to which rate are our people exposed. And when that is uncovered, it is then going to be better for us to develop proper response strategies. Currently, we're responding to 63, which means if there's 10 that have not yet uncovered, we have a 10 that is loose elsewhere, which 10, if we had uncovered it, would have been dealing with the number that is actual, and it is helping us in terms of the response strategy to reduce the impact each individual who's positive, whether symptomatic or asymptomatic, that they would have to expose the next persons. In actual fact, screening in the province is going very well. We are at 1.8 million. Out of 4 million, 1.8 million have already been screened. We must screen everybody because it is this screening that is helping us uncover those that may not be aware of their exposure level. And through screening, we are able to deal with them. We are also doing well on contact tracing. Contact tracing of all contacts that we have, 910, 740 of all of them have been tracked and conducted, which means that is then 81%. What we have in the province is that we now are moving towards ensuring that we would have a provincial isolation hospital. And this provincial isolation hospital would then be used for isolation of those people who would have symptoms. Either they are waiting for their results, or they have already been tested, they are symptomatic, but their symptoms could still be handled in an isolation. They are not yet a hospitalization case. In the process, we are also working in ensuring that screening, contact tracing, mobile screening and mobile testing is strengthened. What we must call on our people in the province, first, is that lockdown level 4 or any other level does not mean no lockdown. Our people must behave in each level of the lockdown so that we don't have a situation where the province is doing well in a highest level and later in a lowest level we get too much exposed because people are breaking rules of lockdown. What we must value too much is life. What we must value too much is also ensuring that all of us do play a role on ensuring that if I am not positive, I'll ensure that others are not positive themselves. And if I am positive, I will ensure that those closer and I get contact with do not get positive. So the province is highly appreciative of the fact that you have joined us from yesterday. Now we're officially welcoming you, which means from Monday, each one of you are going to be an area of your deployment. We will look forward in ensuring that whatever challenges you analyze and get in your deployments, with our staff that you are going to work with, I must repeat, with our staff that you are going to work with, you will give us solutions to the challenges we are facing. South Africans must accept that humanity needs solidarity. And whenever there's a need for solidarity, nations that are not necessarily inclined on making profits will always give solidarity, because humanity is solidarity. Cuba has professionals, and it has a policy of helping and deploying these professionals to all other areas that have a challenge and a need. We are not the first ones to receive yourselves, but we think that on the basis of our relationship and the bilateral agreements with the Cuban people and the Cuban nation, South Africa is benefiting. South Africa benefits, Cuba benefits. So it's a relationship that is beneficial to both parties. But capitalism will never celebrate the role humanity has in solving problems facing the world. Capitalism will always value a price than humanitarian intervention. That's why people move around and even question the amount. It's because of a capitalist mentality that everything that we have has to have an amount attached, because to them value is money. To us and yourselves, value is human intervention that we want to have. And the solution to the exposure of COVID-19 of our nation and also of the world in general. We must appreciate that you have joined us. Thank you very much. And we will consistently work with you in ensuring that your deployment yields the expected value. Which value? It's not money. Value is solution to the exposure of COVID-19 that we are exposed as a province and exposed as a nation. Thank you very much, Professor Luke, as a program director. Welcome to Northwest. Thank you.
Thank you very much, MEC. We are coming to the end of the formal program. I would like to welcome Mr. Pule Monale, the Chief Director of Bojanala District, to come and deliver a vote of thanks on behalf of all of us.
Yes, come here.
Is it you? Okay, so I need to say that, you know, we were actually told on I think Thursday evening that you have to fetch the delegation, the Cuban contingent, to the province, and we managed to get the 13 doctors and healthcare professionals yesterday, and my acting CEO of Klatsop Hospital was very key in organizing the logistics and to get all of you here. So she is going to give the vote of thanks. Dr. Dicking Mahole, the acting CEO of Clarkson Serpong Hospital.
Before you do closure, there's the president of South African Cuban Alumni Association, President Dr. Kihakilwe. Can you wave, President? Thank you very much. Thank you. Okay, you can proceed.
Okay, good afternoon, colleagues.
I can see it.
I've got to give vote of thanks, colleagues. Let me start by thanking the MEC for honoring this day and being with us today, for always being available when we need him. Thank you, MEC. Let me thank all the chief directors that are here, Nela Mojanaga, Pulemonale, and all other chief directors. Thank you for your support. All the political nominations that are here, that are supporting us as health, we welcome your support always. All staff members of the Department of Health that are here with us today, just being with you makes a difference. The Cuban doctors, thank you for choosing South Africa, and thank you for being in KK. Thank you for being in Northwest in particular. Your services are well welcomed. Prof. Luke, for chairing this gathering today, for helping with the logistics of everybody being here today. Your help is welcome. The media, keep on spreading the good news, even the bad ones I know sometimes. But thank you for being with us and making us aware of where we are failing and where we are doing good. Dr. Gonzalez, where is it? Thank you, Dr. Gonzalez, for being supportive. You know, when they talk...
We unfortunately have to come out to that press conference held by the Northwest Health MEC Madoda Sambatha, firstly addressing the controversy around the 200 or so doctors from Cuba, saying that they were not here in South Africa to take the South African jobs, nothing to do with taking employment from SA health professionals. It says Cuba had available resources that came from that country, and they would have been silly not to have tried to dip in and take advantage of that. Cuba already contributed during the struggle, he said, during the revolutionary battle, bilateral relationships with the country of Cuba, starting as early as 1994. South Africa, he says, South Africans must understand their solidarity and the reason why these doctors are here. The MEC for Health also says that from Monday, the Cuban doctors will all be split and deployed to their various deployment centers. That, of course, being the 13 medical professionals from Cuba that arrived in the country on the 27th of April. They arrived in the Northwest Province on Friday, and 8 health professionals, 2 statisticians, and a couple, in fact, one more, I don't see it on my screen, has just disappeared, but we'll update you on that as well a bit later. For now, we'll take a quick break. It's just gone after 3 o'clock. It's 15:05 Central African Time. You're still watching SA Today on SABC News Channel. We'll take a quick break. When you return, we'll give you more news from around the country and the globe. Stay with us.
From grade 1 up until grade 4, I was bullied about my dark skin complexion. That made me to hate myself. I have learned a lot from SABC. I have learned to respect yourself and respect other people and love yourself. One of the shows that have inspired me is Skim Sam. It shows that no matter challenge,